I'd like to welcome everyone to the 2014 SU Research Day and Innovation Showcase. I'm Clifton Griffin, Dean of Grad Studies and Research. First and foremost, thank all of you for being here. In particular, I'd like to thank our Provost, Dr. Allen, sitting back here for her support for this event and for research and scholarship overall. This day is about creating connections. Those connections are important, whether it's faculty member to faculty member right here on campus, or it's creating connections between our campus and the outside community. That's what we hope will be the takeaway message from your presentations today. As you can tell from the program, we have a wide array of topics. It's going to be fascinating. I can't wait. I've already had a little bit of a snippet of almost all of the presentations, and I can tell you, you will be wowed. Also awesome to see some of last year's presenters who are here supporting folks from this year. We certainly appreciate their participation and their being here. Our next presentation is from Debra Webster. The title is Lights, Camera, Action, Standardized Patient Experiences in Psychiatric Mental Health Nursing.
Good afternoon and welcome. I'm Dr. Debra Webster and I work in the Department of Nursing here at Salisbury University. I'm very excited today to share with you a unique teaching opportunity and experience that we're using currently with our students during their psych mental health clinical rotation. So as students begin the psychiatric mental health clinical rotation, they bring with them a lot of anxiety. They tend to worry, will I say the right thing when I talk to the patient? What if I say something that makes the patient angry or upsets them or causes them more harm? What if I don't know what to say at all? What if my patient is angry and aggressive? What will happen? Some of this anxiety and aggression comes from
their past experience of not knowing how to interact with mentally ill clients.
And some of it comes from a lack of education about mentally ill clients. With that said, students do bring a lot of anxiety. All in all, they watch TV at night and they hear nightly news reports of people with mental illness, and it's presented in a way as if mental illness cannot be treated, that patients do not recover. They hear nightly news reports of an individual with post-traumatic stress disorder who's gone on a shooting rampage and has shot a number of people. They hear nightly news reports of schizophrenic mothers who have harmed their children. And the movies also do nothing to help us better understand mentally ill individuals. They sensationalize the behaviors, again, presenting individuals with mental illness as dangerous and unpredictable. So with that, the stigma affects our nursing students as well and increases their anxiety. Traditional methods of instruction for teaching nursing students involves didactic education in the classroom setting, in which we teach theory about mental illness. And in teaching theory about mental illness, we focus highly on communication, which is very important for the psych mental health nurse. Sometimes we do role play. Those methods are not always the best methods for teaching some of the skills that we need to teach for psychiatric mental health nursing. So, what I've done over the past few years is I've developed what we call standardized patient experiences. These standardized patient experiences involve the use of standardized patients. Standardized patients are actors who've been trained to portray an illness. And in this case, we're speaking directly about mental illness. Our standardized patients are given some didactic theory, again, regarding what mental illness is and how they would present with particular symptoms. Our standardized patients are actors that have come from a variety of sources. Some of our actors are members of our local community. Some of these individuals have experience with working with local groups in which they have had some acting experience. Others are retired school teachers, retired nurses, just interested individuals that want to help nursing students to be able to learn about mental illness and how to communicate with patients. The training's very extensive. Each of our actors is given about 20 hours of training, sometimes a little more, again, depending on the actor's past experience, if they've had acting experience and what they already know or don't know about mental health. And in this training, they receive the education about the illness and symptomology. The scripts are all written by psychiatric mental health faculty, myself included, each of us with over 20 years of experience with working with the mentally ill. The scripts are very detailed, and they include a description of exactly how the actor will present the symptoms, some ideas about what a student may say and how they may respond. So they're very scripted, but at the same time, the actor is allowed to go off script and improvise in some ways.
What do you mean by that?
In high school I didn't study and I did perfectly fine, and then when I got to college I studied a lot, but I could barely even pull a C.
And what's wrong with a C? A C's perfect.
So what you just saw there was just a very short video clip from one of our standardized patient experiences. This video clip was just a few seconds, as you could see, but typically our video vignettes last about 5 to 10 minutes in length. This was taken from one of our 3 mental health toolkits. We're using standardized patient experiences currently in 3 different ways. The first way is through the use of a toolkit. The toolkit involves a 5 to 10 minute video vignette in which we try to teach our nursing students some type of essential mental health skill. In this particular one, we were trying to teach the concept of therapeutic communication and professional boundaries. In particular, in this one, we concentrate on both the use of therapeutic and non-therapeutic communication. I'm sure that some of you were looking at the nurse and thinking that, wow, is that really therapeutic what she said? And no, it wasn't. The video vignette was designed in just that way, to show both therapeutic and non-therapeutic communication. We also concentrate in this particular video on professional boundaries, as well as showing some blurred boundaries with some transference and some countertransference. So we're trying to get the students to really understand what it's like to be a psych mental health nurse and to use both therapeutic and non-therapeutic communication with their patients. We currently are using 3 toolkits, and each of the 3 toolkits teaches a different essential nursing behavior. We are teaching therapeutic communication and professional boundaries with one of our toolkits. With a second toolkit, we are teaching how to address a client who has hallucinations and delusions. And in the third toolkit for this semester, we are using a video vignette which actually teaches students how to assess suicidal ideations and do a safety assessment overall. Next year, we'll be developing 3 more toolkits as part of a grant that we received from the Maryland Higher Education Commission. It's a nurse support grant, about $300,000, in which we are developing these toolkits not only to teach our students, but to offer them online for other Maryland nursing schools, so that these nursing schools also have access to some of the same training materials, which we hope will add some consistency to what the curriculum is for psych mental health nurses. Another way that we're using our standardized patient experiences is for what we call special standardized patient experiences. These kick it up just a little bit for our students. They're more in-depth, they're more extensive, and they require a little bit more advanced training for our nursing students. These particular scenarios may involve the use of an unfolding case study, for example. The unfolding case study is used so that the student has multiple interactions with the same standardized patient and is able to see the progression and continuum of care. And at the same time they're able to see the continuum of care, they're able to do some interdisciplinary work with other health team members, better preparing them for the real world again, with going out into the hospital setting and being able to function on an actual team that not only involves other nurses, but involves other individuals within the mental health team, the psychiatrist, the psychologist, the activity therapist, the social worker, for example. Other special standardized patient experiences that we've used have included the use of multiple SPs, or standardized patients. So instead of the student engaging in an interaction with one standardized patient, they may engage in an interaction with 3 standardized patients, representing a patient's family. With that, we're trying to teach the concept of how to interact and engage with families so that we can concentrate on patient and family-centered care. Anyone who's been in the hospital knows that the patient is the patient, however, the family is also there and needs to be cared for as well. So students often have opportunities to engage in family interactions, and sometimes those family interactions involve conflict. So with that said, we set up the scenario so that the students have to engage with a family and deal with some type of conflict. The next video clip that I'd like to show you actually involves an interaction between a student and a standardized patient. In the first clip that you viewed, it was two standardized patients. We had a standardized nurse and a standardized patient, so that we could demonstrate what we were trying to get the students to learn, the learning objectives. And this next one, you'll see a student who's actually applying what she's learned from our second toolkit, which is addressing hallucinations and delusions for a client. And again, it's a very short clip. I didn't want to show you the entire 15-minute segment because I was time limited. Typically, a standardized patient experience, students have two a semester, one at the beginning and one at the end, to emphasize the content of the toolkits that we're teaching. The video is, the standardized patient experience is video recorded. That video recording is later viewed back by the student, and they have to complete an assignment in which they look at their strengths, their limitations, where they would like to improve, the types of techniques they used, and to really apply all of the learning objectives from the toolkit itself.
The dog's always there. He keeps following me. I told them I didn't want to get the shots anymore because they're trying to use those to make it so I couldn't hear God, but then when I stopped that, they sent the dog.
So they sent the dog. Who is they?
The Germans.
The Germans? Okay. So you said something about medication, shots.
Mm-hmm.
What kind of shots were they giving you? Do you know the medicine?
No, they told me it was to help me, but it wasn't what they said it was. I don't know what was in there.
Okay, what did it make you feel?
It made it so I couldn't hear God.
Okay, so it made you not hear do you like listening to God when He talks to you? Is that like
I do.
that's a pleasant experience?
It's important. I have to hear him. If I can't hear him, I can't save everybody. If I can't save everybody, well, then we're gonna have problems.
Okay, so you didn't want the medication because it made God go away, in a sense.
Okay.
So again, that was just a very short clip of the student's interaction. This is the beginning of the semester when the student is just learning therapeutic communication skills, and in this particular case, trying to apply the learning objectives that she's learned about dealing with a client who has hallucinations and delusions. One thing that we do as we bring our students in for standardized patient experiences, we bring the entire clinical group of students in. Clinical group consists of about 8 nursing students. The students are brought into a big debriefing or conference room in which they're able to watch the other students' interaction as it happens live. During that time, they conduct a peer critique so that they can give their peers some feedback on their performance, as well as be able to ask faculty and students questions. And again, in an effort to actually apply learning. Sometimes we have actors that give feedback as well, and the actor feedback may be in the form of written feedback to the student, or it could be in the form of the actor actually coming back in the room and engaging in a conversation with the student. And again, this is all done in a debriefing session. The debriefing happens immediately after the standardized patient experience, during which time we can engage the student in a conversation about how they're feeling about the event. We can address any traumatizing things that happen during the standardized patient experience in an effort to actually prepare them in a very safe learning environment so that when they interact with the client in the real setting at a hospital or in the community, they feel more comfortable engaging with some of these behaviors that students consider to be more difficult to engage with, such as dealing with a hallucination and a delusion. So over the past several years, I've been doing this now about 5 years with our nursing students for psych mental health rotations, and during that time I've been collecting and analyzing data to determine the effectiveness of this as a learning strategy. And what we're finding that it's very effective, that the students actually enjoy it once they get over their initial surprise and shock that they're going to be videotaped and that they're going to have to watch themselves back on videotape, and others are going to see them as well. We are finding that not only does it decrease the students' anxiety, it increases their confidence level, which in turn increases their ability to work with these individuals with mental illness. So the focus of my research in general has been in those areas. It's been on decreasing student anxiety and increasing their confidence. It's been on improving patient to family-centered care, which is one of the CUSIN competencies. And CUSIN is the quality and safety education for nurses. They have several competencies in which we're expected to make sure that nurses are ready to work with clients once they graduate from school. Patient and family-centered care tends to be a very important one. We also focus on safety and quality. We focus on empathy in psych mental health nursing, since that is a core concept of the psych mental health nurse. And some of my specific focus and interest has been on working with the population of post-traumatic stress disorder, since we are seeing an increase of that in our society, and with dementia care, since there's an increased need for nurses that can work with the older population and care for individuals with dementia. So some very specific feedback that we've received from the students includes the fact that the assignments help them to focus on the patient and what the patient had to say instead of just filling out an assessment or a care plan. And this does tend to take the emphasis off the student and put the emphasis on the patient, which is where it should be. They've also commented that at first they were unsure about getting feedback from the actor, but they said that it really did help to actually hear what the actor had to say, because the actor once told one of the students, "I felt like I could tell the student anything because they didn't judge me." So it helps that student to really develop empathy and understand what it's like from the patient's viewpoint. And then the students are not only able to watch themselves back on video, they're able to pick up on nonverbal communication, which is very important with psych mental health nursing. And one of the students said, "I wasn't even aware that my body language caused the patient to shut down until the actor said that I appeared distant." And she was able to pick that up when she looked back at her video. So the videos allow for an instant playback, something that we don't get in the real clinical site. We're not allowed to tape in video, so we don't get the chance to go back and look at what we really said to the patient, how we said it, and how the patient responded. So the actor feedback, when given to the students, tends to focus on empathy, compassion, and respect. Actors have told the students things such as, "She made me feel comfortable when she asked me how I was managing my illness," which is a direct emphasis on that patient-centered care. "The student asked me what I hope to have happen as a result of coming in for treatment." Again, emphasizes the importance of having the patient participate in their care plan. One of the actors said, "Even when I was anxious, the student was calm." This happened to be a particular case in which we were teaching the student about obsessive-compulsive disorder and generalized anxiety. They also give negative feedback. So the feedback that they give to the students isn't always that warm and fuzzy positive feedback. They actually let the students know when they could improve on something. So one actor told the student, "Take your time to listen to me and not just keep asking question after question as if you're checking something off of your list of things to do." So that really rings with the student when they hear something like that. And then treat me the way you would want your own family member to be treated if you were in the same situation. So they do give them some things to think about. The student's able to go back and look at the video and pick up, wow, you know, I really did do that, and maybe this is an area where I should focus on improving. So why standardized patient experiences? We're finding through our research that standardized patient experiences allow us to teach essential psychiatric nursing skills. What do I mean by essential psychiatric nursing skills? Well, first and foremost, communication and therapeutic boundaries, because without those two, the psychiatric nurse has nothing in her toolkit. We're also talking about some of the essential assessments, such as how do you assess a particular client that has post-traumatic stress disorder, one that has paranoid schizophrenia, one that has depression with suicidal ideation, one that has a generalized anxiety disorder with obsessive-compulsive disorder, one that has a personality disorder such as borderline personality and has a substance abuse history, and those that have dementia. And those are actually some of the skits that we've written and some of the diagnoses that we're currently trying to teach our students about. We also find that we like standardized patient experiences because they allow us to decrease student anxiety and help them to increase their confidence, which in turn helps them to have better interactions with patients in the real hospital setting. It allows for that practice in a controlled and safe environment, one in which we can provide a lot of corrective teaching for the student before they actually engage and interact with the real patient. And overall, it also improves the care that these students are going to provide to individuals with mental health needs once they've graduated. So what I've included here are just a few of the recent publications that I've had with my colleagues in which we've looked at different things such as teaching students about dementia care, the use of simulation to reinforce some of the CUSIN concepts where we've looked at both qualitative and quantitative data that's been collected, the use of patient-centered care, and also the use of case studies. And in this particular one, this was a case study that we used for post-traumatic stress disorder. So, questions? Yes?
Thanks, Debbie. I don't have a background in healthcare, so when I started here as dean, I said I want to go out on a clinical and see what it's like. And the first one I went out on was in the psychiatric rotation. And just the level, the volume of information students have to have in their head, whether it's related to all the diagnoses or the medication or non-prescription medication that people might be taking, and then the social dynamic around the family is absolutely fascinating to me how the students juggle that, and it's obvious how the value of having the opportunity to dry run is really important. But also I was struck by how so many of us have family members that have struggled with these illnesses, and that students can be overwhelmed by seeing their father or their mother or their uncle or their sister and the patients that they treat. So I wondered if you could talk about the value of that to students and kind of addressing some of their own personal issues when they're going to be working in that area.
Absolutely. We all have baggage, as we know, and we all come to the clinical situation with our own issues, whether it's a student who has anxiety disorder themselves that they're being treated for, or issues of depression, or a family member who's schizophrenic or bipolar. We are able to, through the process of having standardized patient experiences, allow the students to practice in that safe environment, and then during the debriefing session can talk about maybe their own issues, not necessarily in front of a clinical group, but privately with an instructor, so that if need be, we can send them for their own referrals, we can guide them in the right way. We certainly don't become their nurse because our job is not in counseling. We allow the other counselors to do that. But certainly it allows them the opportunity to address those issues. And as they learn more about mental illness and how to engage with these clients, I think it helps them to either provide themselves with their own self-care that they need, or to help their own family members to maybe get the resources that they need that may be already missing in the families. Yes?
Have you seen any kind of influence that incorporating the standardized patient in the scenarios you were giving, has that influenced the number of students that have chosen to take that path into psychiatric nursing or?
That's a really interesting question. The question was about if we've been able to have more students go into psychiatric mental health nursing as a result of their participation in this. We have not collected any data on that. However, it's a very interesting concept, because over the years, as I've been teaching psychiatric mental health nursing, this isn't a preferred field for people to go in. As we're recruiting, we see fewer and fewer people that are interested in psychiatric mental health nursing. Most of our nursing students want to work with babies and children, and they want to be in the ICU, and they want to be in the emergency department, because that's where they think the excitement is. That's where they think that they're going to make the most difference. So it would really be an interesting thing to find out if this has any impact on that. So I guess if there's anyone interested in that type of research. But we do see more and more people at this point that are interested in psych than we ever have before. So that is a good thing.
Time for one more quick question.
Yes?
So if you were able to dream and do anything that you would want to do, what would be next?
Wow. I was able to dream and do anything that I wanted to. Does it have to be related to standardized? Okay, see, you left that wide open, but if I was able to dream and do anything that I really wanted to with the standardized patient experiences, wow, it's really difficult for me to choose one thing, because there's so many directions that you can go in with the standardized patient experiences. One of the things that I've been really interested in is developing some type of scenario in which we not only use a standardized patient, but we use one of the high fidelity mannequins that we have in our simulation center, And perhaps it would be something related to chemical dependency issues and addiction, where we could maybe simulate a standardized patient who comes in an unfolding case study and presents with an addiction, later presents as an overdose. And of course, we certainly can't kill a standardized patient, but we could take them into the mannequin and actually teach them how we would deal with that. So that would be just an example of one thing that I would be interested in.
Fantastic. Thank you, Debbie.
Thank you.